is it safe to do ketamine on a regular basis, or is it because it's not covered by insurance? What you're doing, is it too expensive? And what is the cost if someone's going to do it out of pocket?
$375. Sometimes the insurance company will pay some. Sometimes they won't pay anything. They want you to have at least 5, 6, 7, 8 treatments, and then hopefully the effects will spread out and be longer.
Welcome to Be Informed, Be Well with John Malanca.
Hey everybody, welcome back. John Malanca, United Patient Group, Be Informed and Be Well. And I have another return special guest, Dr. Paul Bregman. Paul, how are you?
I'm doing fine. It's nice to be back.
You're live on camera. I didn't tell you you're live yet. So you're live on camera.
Thank you.
Good to see you. So Paul, for our audience members, Paul, when Crit and I started United Patient Group back in 2011, I think you were one of the first people we met at a conference, and we'd always see your face, and and you spoke, and I'm like, okay, who's this guy? And so our paths have always crossed. And then I remember I was in, where were we? Patients at a Time, and I was emceeing the conference and in New Jersey, and I look out in the audience, and it was months after Corinne passed, and that was my just to get back out there, and don't give up. And I remember seeing you in the audience, and I was like, and you came up to me afterwards and just said, and so it was nice to see a familiar face. And so, you go through a lot. Everyone has this book on the outside cover of what everyone perceives us. Oh, Dr. Bregman, MD, must be successful, must be doing this, doing that. Happens with everybody. And what I didn't know is that you've been going through depression for years, but also diagnosed later in life with type 2 bipolar. And I don't know if you call it disorder or not, but and so can you share that? Because we've done a couple podcasts, we've done a couple Facebook Lives, and it's amazing on how many people that I talk to on a regular basis. Hey, I just saw that video with Dr. Bregman that helped me. It made me feel that I'm not alone. And so thank you for being open and honest. And I know you're still going through things, but I just need you to know that you're not alone, and your story is helping others on here too. So let's get on it, man. It's been we did our first podcast probably about 1.5, 2 years ago. And what have you been doing? I know we talked about other modalities besides cannabis. You've been on antidepressants before. You've gone to therapists. You've looked at psilocybin and ketamine.
Right. So I've done a number of different things, and I was diagnosed. I went through. I'm a diagnostic radiologist and a ketamine and a cannabis expert, and so I was diagnosed. My father had bipolar, and my mother did as well. So I genetically picked it up from them, and it really started at 29 when I started my residency, and then was officially diagnosed at 41 when I was feeling more depressed and everything. And then at 45, I had to retire disabled because of depression and suicidal ideation, and also irritability, and that's bipolar 2. I had bipolar 2. Bipolar 1 is when people are very manic and also have depression, but manic where they're really not sleeping, and they may have psychosis and hallucin. I suffer more. Bipolar 2 is more of the depression and more of the irritability, and also suicidal. There's a component of this that has a lot of suicidal ideology. So I think about suicide. I haven't tried to commit suicide. I've been in a gun shop a couple of times, but I've always gotten scared. And the key thing about keeping me from staying alive has been the fear of killing myself. And then I got married, and I have young kids, and I was fearful of leaving that permanent mark on them. So with the history of bipolar type 2, and I was working as a radiologist, and I finally, in 1995, when I was 45 years old, I had to retire disabled because of the depression and the suicidal thinking. And I was working with a psychiatrist there, and he gave me every medicine that was on the market, from Abilify to Seroquel to anything else, and none of it really worked. I was in that category of being treatment resistant. So with that in mind, I went to get electroshock therapy, a full dose from 1994 to 2002, and there was a mishap in 2002, and it always helped me, and it was a benign procedure, and always helped me get out of the depression and so I would recommend that or look into that. And so I had a bad episode. I didn't go back for 18 years. And then I went back, and after the second treatment, it aggravated a heart flutter, atrial fibrillation. So that has moved me into suffering with my illness, with the suicidal ideation and the depression. But I've moved into looking at ketamine. Ketamine is out there in clinics now, and it's under those psychedelics type of thing. So what I've been doing is ketamine infusions. They do it nasal spray, they do it pills, but I get an infusion for like an hour, and it's taking like a small trip out there. But during that hour, when I come back after the hour of the infusion, I feel no more suicidal thinking, no more depression, and no more rumination. But the problem is it only lasts for about 36 hours, short acting thing for me. So that is incorporated in my help, and I'm working with the insurance company. But the major thing has been for me, because of the no medicine working from age 45 to really now I'm 72, is that I've used cannabis along the way. And cannabis has been a lifesaver for me because it has lifted my mood and helped with my anxiety as well. And so that came as a lifesaver, that if I didn't have that, I would not really have any medicine on the market to use to help me with my mood. This is a mood disorder.
That work for you. For our audience members, ketamine was just, I guess, introduced in Belgium. It's funny. I used to live in Belgium, but ketamine was used in Belgium for anesthesia for animals. Actually, some people would say it was a horse tranquilizer, and then that was in the 60s. In the 70s, it was used as an anesthetic in the Vietnam War, and then as time went on, in the 70s and 80s, a lot of paramedics, when they're helping someone who is attempting suicide and they're manic, as you're talking about, they were using ketamine once they saved them, and how they did it. I don't know if it's a nasal spray or pill or IV, but it would just calm them down, and they'd be able to take them to, I'm assuming, the hospital or psych ward, just calm down. And as time went on, even with cannabis, where you're seeing all these studies like, I'll be darned, it works for this, it works for this, it works. Boy, we might start looking at this as another modality for whatever ailment. And they're finding that with ketamine with patients, that we're seeing the benefits with this. Let's do some studies. And so now it is becoming, I guess, used more often. I don't know if it's legal in all states. I believe it's legal in California. You're in Colorado. And there's an FDA-approved nasal spray, which insurance covers. And so for you talking about doing you're talking IV, correct, is what you're doing, those treatment, infusion treatments?
Yes.
And so does insurance cover that?
No.
So what's the difference between the nasal spray and that is covered by insurance versus an IV infusion, which is not? Why not?
One is FDA approved and one is not.
Gotcha. So is that like Marinol FDA approved and
cannabis?
Yes. Gotcha.
And it's not that effective. It's effective for some, and they even have a pill now, a ketamine pill as well.
Yeah, I knew that. And so is it and what is a milligram dose? Because over the years of, hearing, through college, stuff
I
like
think
that.
that varies with the infusion. It's like 0.55 milligrams per kilogram. It was a 55 milligram dose, but it was a very trippy dose. I mean, it was very, very powerful in my mind, where I didn't recognize that my feet were connected to my legs, during this. And it was that way, but the powerful of it, after an hour, it was over. And then I walked out of the office and I just had all of the bad feelings go away. But that was just the medicine. And I think with the psych situation, it really needs, not only do you need a psychiatrist handling the medicine, but you need a therapist that you're talking to on a regular basis. You need a case manager that's going to look at your life. You need a vocational rehab person that's going to help you get a new career. And the biggest thing that came into my life was that I got involved with a conservator, someone to handle the money, because you're sick and you go to the psychiatrist and he talks about a lot of different things, but no one is leading you outside of the office to handle the other aspects of your life. And if you're not married to someone who can handle all of those things, or if you're all alone, you need a team around you. That's the key thing.
So you mentioned type 1 being manic. More
I have hypomania,
so
and type 1 has real manic, where their nose is pressed against the window.
Gotcha. Because I remember one of our previous conversations last year or two, you were talking about, if you made $1, you spent $5. With the managing money. Is that, do I remember that correctly? Because that happened with my friend's daughter.
Correct. There was no budgeting. I had no conception, and I could rationalize away spending money as well, when I should have had somebody in control if I was getting $10,000 a month from disability, I should have gone to someone and take it away. And I should have worked with $7,000.
Yeah. So is this working? Is it working? Because I know, over our conversations over the last month, it sounded like it was working, but before jumping on the screen here, it sounds just like this. It was just a temporary fix. And if it's
a temporary fix, and I have my psychiatrist and a case manager at Humana trying to fix this for me and get this approved, so I can have the ketamine aspect of things and go from there. As far as the team approach, having the conservator and the case manager and voc rehab and things like that all came into place as well, and really kept me from becoming homeless.
So when let me ask you something, because this has happened. First off, my mom says hello. She really felt connected with you, and being a great mom, she just wanted to give you a hug on one of our past things. And so knowing that we were doing this, she's, oh, please tell Dr. Bregman I said hi. And then Beth Dost, who's not only a dear friend, personal friend of mine, but of United Patients Group. She's a nurse, and she's experienced this with some of her patients. And so, she has shared your story numerous times. And when I did share that I was going to be doing this, she said, oh, please tell him I said hi. And so, again, that's at the beginning of this podcast. I said, you sharing your story and is how easy or how hard it may be for you. You're not alone, and you're helping others. And so I just want to say thank you, because, sharing personal stuff, complete strangers sometimes it's helpful, and sometimes it's difficult to do. So I do thank you for that. So with you, one thing Beth brought up this morning when I was sharing with this, she said, ask Paul, because I don't know if it's a family member in her family, bipolar, and the spouse passed away, and that spouse was their safety blanket. And once that spouse passed away, all the manic stuff started coming back. Did you see more of that, not only with one divorce, which, I've not experienced that. I've experienced breakup and of course the loss with Corinne, having the loss of that, but also your kids now in that teenage year where they're moving on. We're like, they don't want anything to do with mom and dad. Does that bring up a lot of stuff that your daily stuff that's coming up of not having that security blanket anymore?
Being alone,
Yeah.
I'm glad I left. The person that I was married to was more of a rescue marriage, and we didn't belong together. So it was better for the kids when I left, and they were 3 and 6. And they even had a sense that we didn't belong together. It's been out of that relationship. I didn't necessarily realize that what I needed as a mental illness patient and as bipolar is really stability and also this solidness of type of thing. But I didn't work on that to get to move to that point until recently. So yeah, it's been an alone type of illness, and I didn't know how to deal with it. But now I have a better idea about how I deal with it. And with the kids going on, I think the kids are developing their own personality. And I think part of them is that they have grown up to a degree afraid of seeing their father sick.
Yeah, who wants to see that? For others that are going through this, depression, anxiety, loneliness, are there support groups that you can share with others? Are there any like you hear people going through AA and
yeah, I think they have to look up their local support, the Colorado Alliance for the Mentally Ill. I think there are ones that could be Googled, as well for support, because I think support is very key. But I really get back to that team approach of it's not just the psychiatrist, it's not just the therapist, it's the conservator to have the money, it's the voc rehab, it's the case manager, it's all of these other components to plug in to the patient so that they have these pieces that are filled in. Because if I would have had this team at 45, I would have had a couple of $1 million. I would have certainly a job. I would have had these other aspects of my life that would have been filled in. And so the psychiatrist never addressed these issues. And therefore, I left his office, but I was still on the outside looking in. I didn't have it under control outside his office.
Yeah.
So people have to kind of remember that aspect as well.
Gotcha. Let's go back to this ketamine treatment, because I really know a lot about it, and so I'm assuming our audience, I hear about it, I've heard about it for years. It was even at one point, like a club drug, wasn't it? Like ecstasy and stuff like that. People would call it super K or special K, I believe is what it was. But this is not what you're doing. Can you give us a walkthrough of what a treatment? Because I know we were supposed to film this last week. You said, John, I have a treatment, and so can you share with our audience?
This is still used in the operating room and still used at those high lows. This is a very low dose according to your weight, but low dose, and it's given to me in an infusion. And what I'm feeling is a dissociative, lovely experience from my body within the hour as the IV is running. And that's giving me a rewiring or a reset of my neurotransmitters so that the thoughts that I went in with, suicidality and depression and rumination, is all reversed by the effects of the IV ketamine. And during my trip, I'm dissociated from my body and I'm floating around the room, and it's relatively pleasant. And then after that, they put a new IV and they flush it out of my system, and I'm back to having this type of discussion with you.
So two things. Does a trip, the way you describe it, does it last 2 hours? Because I know at the beginning you said something about 36
No,
hours.
it just lasts an hour. It lasts like 40 minutes.
And so what was the 36-hour thing that you were talking about at the beginning of our conversation?
36 hours of not feeling suicidal,
Gotcha.
not feeling depressed, and not having rumination.
Gotcha. So since I'm assuming this is what you go through on a daily basis, weekly basis. I mean, is it constantly here? And is it safe to do ketamine on a regular basis, or is it because it's not covered by insurance? What you're doing, is it too expensive? And what is the cost if someone's going to do out of pocket?
$375. Sometimes the insurance company will pay some. Sometimes they won't pay anything. They want you to have at least 5, 6, 7, 8 treatments, and then hopefully the effects will spread out and be longer. I had 8 treatments along the way, and each time I had the treatments, it lasted for 12 to 24 to 36 hours, and then it disappeared. So that was my personal case.
And is there any, I guess, warnings or side effects that they take? Does it affect brain, heart, livers, kidneys, and anything else like that?
Not really.
No. And you being in the medical profession and have been for quite some time, is this something that you would recommend for younger?
I would say go through the medicine. I would say go through the medicine and see if it works and see what side effects you're experiencing. Because like Depakote is given out there, but people wind up gaining 50, 60 pounds and become diabetic. So you take what they give you, you go through that. You can also have a genetic test on a swab on your cheek, and that can be sent off to the lab, and that can come back to tell you which of the medicines, psych medicine, you're most prone to have success with. So that's where I would start.
Okay.
And the psychiatrist may say, oh, we don't want that, we don't need that, and stuff like that. That's bullshit. You need that because that'll give a good list. So then you go through the medicine, and if that's not working or you're not getting any better, then it's time to talk about ECT.
And is that shock?
Yes, because that will, ECT, electroshock therapy.
Gotcha.
And that will last, you'll have 3 months of treatment, and that could last for a whole year with you getting maintenance dose along the way. Very benign, very good, excellent.
And is that something we see like we see in Clockwork Orange, where they have prongs on you and how?
Yeah, they just put it here. It's very sane. It's very safe. In most hospitals around the city or something, there may be 3 or 4 hospitals that are doing patients from 7 in the morning to 3 in the afternoon, every half hour. So both inpatient and outpatient.
Let me go back to the ketamine. I'm really interested and curious about the ketamine. So when you're on your treatment, is it a guided treatment with the therapist talking to you? Paul, let's talk about this, or are you just sitting there? I'm
sitting there, and they check in and just see how I'm doing. But if it would be nice if it was a guided trip because this time around I would have been able to really get much deeper than I am when I'm not on ketamine and talking to my therapist.
So just to hear you correctly, the therapist is not there. They're just looking in the room, making sure that you're still breathing.
The nurse is checking in every 15 minutes just to making sure I'm doing okay. Gotcha. And how I'm doing. And if I'm having go ahead.
Do you think it'd be more beneficial if the therapist was actually walking you through and talking you through like you would?
Yeah, at least this time it would have been, because I was on a different plane, and I would have explained to her how in depth I was feeling about my suicidal thoughts and about my depression and what it all really meant. It would have gone from a level 2 or 3 to a level like 7, 8, 9. Like I really feel this way, and I really want you to help me with this. It just would have felt deeper.
Yeah. What can you share with anybody else that's going through this? Doesn't matter what age they are. What can you share? You've been dealing with
the fact of what I said about my team being assembled. They shouldn't be alone. They should investigate if they're suicidal, especially, or depressive. They should follow and talk to the psychiatrist about what the plan is going to be, trying all the medicine, getting the genetic swab, and then if it's not going to be working for them, talking about the ECT in a very real way and not be afraid. And if they don't want to go that route, then plug in and investigate the ketamine as an alternative as well. And whether that's going to be an infusion, a nasal spray, or a pill, there are ways to do this to save your life so that so that you don't kill yourself.
Yeah. Well, I mean, yeah.
That's what I'm talking about here. I'm talking about trying to work hard and not kill yourself.
Is ketamine legal in all 50 states?
Ketamine clinics, I think so.
Yeah.
In for medical practices, yes.
Yeah. And ECT, is that covered by insurance?
Yeah, that's been around for 50 years.
Okay.
And that's very easily. But people, even the doctors have a prejudice against pushing that. And if you're not getting well in 6 months and they've tried all the different types of medicine and stuff, you need to bring it up to the doctor and say, I want to investigate ECT and I want to look into this. And if that doesn't work, then you definitely, if you're suicidal or really down, you get, at least if you get one ketamine treatment and you can pay for it and you can resubmit the forms, it will give you some relief.
Good. You know, the reason I asked earlier about does it have any side effects, because a lot of these other medications have issues on the gut and liver and other organs in the body, as well as you mentioned, you know, puffiness. And so it doesn't sound like there are too many I guess side effects. I don't know. Is it synthetic or what is?
I think ketamine is a synthetic deal. It's clean. The whole thing is clean.
Gotcha. In all modalities of the spray, the pill, and the IV infusion, do they all last about the hour?
No, the infusion is the most powerful.
Gotcha.
The IV, the pill may or may not work for some people, and the spray may or may not be as effective as anything. But the IV infusion,
hence the FDA approving that one,
right? But the IV infusion is the one you want, in my opinion.
Yeah. So you did one last week. When will you do your next infusion?
Well, I'm going to wait for the insurance company to let me know what the story is. And I may book another one that I'll pay for out of pocket because I feel so good. And I like the anticipation of feeling good as well.
Of course. So what's the next step then? Do they recommend, or do they say not to? You know, I'm a big fan when you're going through something like cancer. You know, patients ask me, hey, I'm going to try chemoradiation. If that doesn't work, I'll try cannabis or some other modality. And the good thing about cannabis is that you can combine different modalities. And I'm a fan of battling something as severe as cancer, you know, having a whole arsenal behind it. Regarding depression, is that the same thing, or do they not want you to mix and match?
I would ask the psychiatrist, but I would think if you're in a suicidal place, depression is one thing and that hurts. And I would ask that question. But if somebody comes in and says, I am in a suicidal place, I would rush to talk and get that aligned to get you out of that place.
Good. Are there more times that these suicidal thoughts come on, like leading up to the weekend where everybody else is doing things? And, you know, are there different times when these thoughts come on?
No, the suicidal thoughts, yes, come up at different times, but they also come up as part of the diagnosis for the last 20 or 30 years. Because of just mistakes that have been made.
Yeah.
And it's also part of the diagnosis of depression, of what am I doing here? And now I'm getting older. So it's what's the purpose of my life? And if my kids are having problems talking to me,
Yeah.
everything seems to just be bigger. And you just, but the major thing has been turning 72 and saying, what's the purpose? What has been the purpose of all of this?
Yeah.
Why have I suffered so much and I continue to suffer on?
Well, there has to be, I mean, believe me, when Corinne passed, I thought the same thing. Really? What's the purpose? You took the love of my life away from me, and what is the purpose? And I think, faith has helped me, but also getting up every day and going for a run or a ride, my bike, rain or shine. And that's what helped me, and I know everyone's different, but not giving up. People say, God, I'm so proud of you for not giving up. I'm like, well, I'm not ready to leave. I believe me, if there was a guarantee that I could go see Corinne and say, hey, you're not supposed to be here for another 50 years, John. Well, I couldn't wait that long, but if there was a guarantee that I'm going to see her, I would, staying here and having faith, and, my family, as you mentioned, family and friends are important, and being able to get outside. I mean, for me, working out is what helps me, keep grounded. And so with you, you're such a personable guy. What about writing a book? What about doing a podcast like this?
I have done.
What about even being a counselor? Going and being, going to these, I guess, support groups, and being that regular spokesperson there to share. You're not alone. Guys, I mean, I'm certain, your message can really reach a lot of people.
And so I'm in the process of trying that, working with my therapist on that. Yep. and moving forward.
Yeah.
Because, I really want to live, and I just want to figure out, I mean, I know the ketamine can help me, and I know, that can help. And so I have things going on, and just have to absorb the blows and just be forward and be there.
Does working out help at all? Walking, getting out of the house? I mean, I know
it helps. It helps a little bit. But when you've experienced the ketamine, and you've experienced a total whitewashing of the board, you can't imagine anything else that
so that
close to that.
So let me ask you, like people say, is cannabis addictive? No, I think it's habit forming. Is ketamine addictive?
Yeah, I think so too. I think they give low enough doses that if you're taking it at home and you're taking a pill, that you have to be aware. John, we're dealing with the quality of someone's life. So
I hear you.
I'm not saying that you're making a judgment.
Yeah.
I'm just saying that people have to realize most people have no understanding of what we're talking about. You have to understand that. So when I say that I'm here to survive and make it through, they can't conceive of what that addiction may cannabis dependence or ketamine dependence. I'm just trying to get by.
No, I get it. And the reason I asked you these questions, and I'm not only asking, but I'm asking for the audience too, because a lot of times I get emails and messages and said, is it this, is it that? And so that's why it doesn't matter if I'm talking to you about ketamine or talking about anxiety in seniors or whatever. And so that's why I'm asking these questions for that reason, just because I want you to be an educational piece for our listeners, where they're ask this question, ask that question. So that's the reason I'm asking.
And I'm just saying, I'm geared more toward the quality of one's life.
And there's nothing wrong with that. Believe me, I mean, I know a lot of people that live on cannabis 24/7. They said, listen, you wouldn't like me if I wasn't on cannabis. On cannabis, I feel normal, I feel healthy, I feel alive, and I feel centered, homeostasis, balanced. And so, so I'm not here to judge anyone.
Oh, I know. I didn't take it.
No, I
But
didn't think you were, but
I think the ketamine is just another important avenue to go, as well as the other medicines. I think a lot of people on mental illness who are taking good medicine that the doctor has prescribed that's working well for them. They shouldn't blow off all of those for ketamine or ECT or anything. They should try what the doctor has suggested.
So what happens? So it's like cannabis, because I work with a lot of seniors and their doctors. It happened with my aunt. I'm gonna act like you didn't ask me that question about cannabis. She's like, you've been a doctor for 30 years. So I said, what'd you do? She said, I went and grab another doctor. So for our audience members that are maybe going through something very similar to what you're going through, and they ask their doctors about ketamine or electric shock treatment, and they're denied, thinking that may be, they may think that's my only hope to help me get my mind straight again. So what happened? What can you share with our audience members, and and maybe they've been denied?
I think you have to ask that doctor to give you the name of one or two other doctors that you could talk to.
Good. And that's the whole purpose of this, is sharing your story and helping others that may be listening and going through the same thing, and knowing that they're not alone. And you may be that sign, like, oh my God, I've been hoping and waiting and praying for a sign. And you could be that sign, Paul. And that's the part where, live out your life, because I know you're
suicide, right? But suicidality goes to ketamine. If you're thinking seriously about suicide and it's not going away and you got it, you talk to your doctor quickly and you sign up for a treatment with suicide on the heels of a recommendation from your doctor, because no one should have to carry that weight.
No, not one thing. And it sounds like over the last 30 plus year period, you've tried a lot of things, from medication to electric shock to meeting.
And the electric shock worked, and the ketamine works better and quicker. And the cannabis has worked a great deal as well.
Can you do all three? And are you doing all three?
Yeah, the night before I do the ketamine, I don't do any cannabis. That type. I clear up. Or 2 days before that, I don't do that.
Per your personal thing, or is that their recommendation?
The recommendation, I think they said the day before. Don't do any the day before.
Yeah.
Electroshock, you have to stop a few days before. Some of the mood stabilizers and things like that.
Yeah.
And diabetes medicine. But those are I had the best benefit for all those years with using electroshock therapy. And I went during the winter, and then I was free of any depression or anything for like 8 or 9 months.
Maybe you need to, like a lot of the snowbirds, get out of the, at the beginning, I talked about Belgium, where ketamine was first introduced in the 60s. Belgium is a beautiful country with beautiful people. But when I lived there, it was depressing. It would be pouring rain,
like
360,
like Portland, Oregon, or Seattle.
Yeah. And so, we had to get out of there, and come April, when the sun would shine, you're like, oh, bring it on. And you saw everyone was happy, but so I'm a big fan of getting sunlight, getting out of there. A lot of people in Belgium would wear glasses like you have on right now. I don't know if there's a special glasses, but they would go into, sun rooms, or wear these special glasses that would, blink lights at them and trick the brain. Hey, this is vitamin D. So, well, where do you go from here? What's your next step? I'm
fighting with the insurance company about getting more ketamine. Mm-hmm. I'm using my cannabis. I have to figure out what's going to happen with my job situation and how that is really going to look. I'm going to continue expressing love and to my children, and just waiting on that. and I'm just mainly just trying to stay focused and have some quality of life. I met a woman online in
Awesome.
Taos, New Mexico, so I'm continuing on with that, and that's where I'm. That's what I'm doing.
Nothing wrong with a little touch, and maybe that could bring internal.
Oh, that would be joyful. That would be
So,
joyful.
If anybody's out there right now, we have Dr. Paul Bregman, single. look at. We'll do a love connection here. So anyway, Paul.
So Paul Bregman.
Paul Bregman.
And cannabisresource.info is my website. mdbregman@gmail.com. 303-550-4115. And I'm here to discuss mental illness. I'm here to discuss cannabis and just connecting and just letting you know what I think is the right thing to do.
Well, I
through experience. And John is such a good man.
Oh, man.
He's a saint. He's a saint.
Thank you, my friend. And always good to see you, talk with you, and hope that we can see each other in public one of these days.
Yeah, thank you for giving me this opportunity.
Always.
Thank you very much.
And right back at you. And your love, my friend. And I love that last how you close. You said, just pushing love forward. And I just think, as Corinne would always say, is you're in the trenches, heavy backpack, pouring rain, in the mud, and just one step at a time. And so you're doing that, and even through the bad and also the good days, you're still doing it, and you're not alone, man. And
okay.
Thank you. And thank you to our audience again for everything that you do with the UPG family. And
all the best. UPG. Thank you.
So,
love you.
John Malanca, United Patient Group, Be Informed and Be Well, and Dr. Paul Bregman. And we'll see you all soon. Have a blessed day.
Appreciate it, Johnny. Bye. Thank you very much. Bye.
Thank you for listening to Be Informed, Be Well with John Malanca. Be Informed, Be Well is brought to you by United Patients Group. Come and visit us at unitedpatientsgroup.com. And thanks for listening.